real life. And the myth which is there that they are violent and they are very, they are not social and all, it actually comes from the fact because the movies depict them like that. So many times there's a schizophrenic moving also, and you will not get to know that there's a schizophrenic around you. And all the more there are not diagnosed schizophrenics. There can be people with the ones who have never gone to a doctor, and they may be having various symptoms, the right kind of indications that they are schizophrenics. So it is basically the myth has been empowered by our movies. Like over here, I think only 3 of you have seen schizophrenic in real life. But whereas it comes to, again, if I ask you, the schizophrenic person whom you saw, was that person violent? Not necessarily.
If it's uncontrollable, not treated, then maybe.
So maybe there are arenas in mental illnesses where people feel that there is some sort of frightening part or threat to them. Then they get violent. Or people are not treating them in a right manner, then they get violent. But the fact is, statistics show that the incidence of violence in people who have brain disorder is not much higher than it is in the general population. I find people getting violent on the road. Earlier I used to find Mumbai very calm. These days I am finding Mumbai population getting very, very violent. Somebody is banged into somebody's backside of the vehicle, and you will find them getting off the vehicle, holding collars, shouting at each other, abusing, even hitting. Till the time somebody comes to save you, the other person has got 1 or 2. And God forbid if it's a auto wala, taxi wala, then all of us have the right to hit them, abuse them. You know why? Because they are the people who are taking us around, they are the people who are service providers. So we have all the rights. So I have seen this huge change in violence coming. You see so much of news coming wherein a teacher has been killed by a teenager. In South, recently there was a news wherein a teacher who had reprimanded a small child, a teenage child, has been killed. The violence per se, if you compare it with other arenas of life, mentally ill people are in fact less violent. We have general violence incidents happening more. Do you agree with me on that, sir?
Yes.
We have more of violence on the roads.
Summer season is more high temperature.
Yeah, so maybe weather also maybe contributes that people get very heated up, and yeah. So maybe, yeah.
Yesterday in Mumbai, very one second. After 2 minutes I come. In Mumbai Mirror yesterday, an article has come, page number 12 of very nice way in which how a caregiver should treat the schizophrenic patient. And secondly, basic, I have also come across more than 15-20 schizophrenia patients in my clinic. Majority of them are having hallucination, auditory hallucinations. They feel that somebody is talking about themselves, and self-harming or harming others is what all of us we somewhat go close to calling them as mad. Nobody is mad as such. In fact, you have seen the write-up yesterday.
Yeah, I have come across that. It's a very nice write-up. In fact, that's a very interesting field when we talk about counselors and caregivers. What should be their behavior and their dealing tactics when we are talking about schizophrenia, other mental disorders also. In fact, we were just talking before my session with Mr. Partharthi, since he's also from the same field, that there is an inherent need to understand what type of attitude should you have before getting into this field. Can you have that kind of strength and personality to be able to hear out someone's depressive issue? Or are you strong enough that you can keep your problems aside, not get into transference and help the other person? You need to be very, very strong to be in this field. Just by getting a degree, or just by studying, or just by being able to quote definitions, you cannot be a caregiver. Your first responsibility is towards yourself. If you are a happy person, you are a person who's normal in everything going around you, you are able to adapt to situations, cry, be angry, be normal, become a caregiver. Become a caregiver then. You need to know yourself much better. I find lots of very young people getting into this field, but the moment they meet somebody with mental illness, they get so emotional about it. They get affected themselves. So before getting into this field, we need to have some sort of an attitude test or aptitude test which suggests that whether you are fit to be in this field, whether you yourself are so fragile in your mind that you can handle people or not. Because there will be people who will be coming to you with high expectations. They would want suggestions, help, empathy from you. They shouldn't be transferring your problems to you while going out of the session. So you need a very, very strong persona. You need to be a very strong motivating force yourself, very sure of your personality, what you want to do in life. In fact, I have seen lots of people who are working in mental health field after working 30, 20 years in other fields. Because this is something they find a lot of contentment in. They have studied, re-studied to get into this field. They find when they help and talk to people, they are very, very self-contented. So this change can come in you after 20 years of your life also.
This has come in my case. After working for 40 years,
You realized.
switched over to paramedical science.
So Mr. Parthsarthi actually was in a very different kind of a job 14 years back. But after that, he decided that he wants to become a caregiver. He wants to come in this field and help people with their issues. So I think it is a very, very strong field which requires very strong people. By strong, I don't mean ye wala strong. I need strong from mind. I need people who are like, who will not get depressed after hearing to a depressive. Who will not get anxious after hearing someone else's anxiety. Your mind on your shoulder should be a very strong entity which can come up immediately with diagnosis and suggestions for the other person. Therapies for the other person. Yeah?
In fact, if we can use the word instead of abnormal, if we use the word subnormal, that will be better.
That's a very interesting suggestion. We should use the word subnormal in place of abnormal. As it is, India has also started getting lots of cases of people who are deviant in their behavior and in many ways not fitting the normal course of life. So in place of calling them completely abnormal, in fact for common mental issues, I would say everybody is suffering from stress. Everybody is having a little bit of depression, some or the other phase of life. Some death, some sort of thing. How do you deal with it and come out of it and start walking? Are examples for other people to read and understand. Yeah.
There are 417 types of mental ailments. 40% of those ailments are there with all of us at some point or the other.
And we don't know
Who
them.
is not eccentric in this crowd?
That's a very good question. Who's not eccentric in this crowd?
At least once.
Yeah. Another myth which I am talking about here is when I talk about mental illness, many people feel that mental illness is a result of bad parenting or bad character. Bad parenting and bad character. Like for example, somebody who's suffering from some deviant behavior, is violent or is getting into addiction. Addiction also is a mental illness. It is also a mental disease. So again, if somebody is getting into it, people think that the value system is not in place. The parents have not taught their children how to behave. Or they have a bad character. The character is deviant. They are the people who get into negativities very fast. They are not able to get over it. So there is this belief in many people that is one of the reasons why many people are afraid of going and visiting counselors. They feel, I will be tabooed as a person who has a bad character, who is not being able to cope up with normal issues in life.
Fifth line is a very good one.
Yeah.
A serious mental illness cannot be willed away.
Yes. Mr. Parthsarthi is saying that a serious mental illness cannot be willed away is a very true line. If you are really mentally sick, if you are really having a disorder or a disability, you certainly need some sort of help and aid. Now that help and aid can be technical also. That help and aid also can be through some friend in your society. Maybe you're talking it out is a big help. Maybe you're sharing it with somebody is a big help. But if you're not sharing, if you're not discussing, not going for help, you may be aggravating that form of disease. So it cannot be just, you can't close your eyes and say, okay, this is a phase-wise thing, this is a momentary thing, I'll be okay in 3 weeks. You will not be, you will in fact give in to it. You will succumb to it. Your other parts of your life, your arenas will get affected in some days. The fourth myth which I want to talk about here is depression. Depression results from a personality weakness or character flaw, and people who are depressed could just snap out of it if they tried hard enough. Many people think that depression is something which you keep on getting in some days, and it's just a part of your personality or maybe your day-to-day life, and you're depressed today, tomorrow you'll be fine. Again, after 3 days you're depressed, 4th day you'll be fine. But then this recurrence of depression, and the day you are depressed, all those symptoms need a recall, need an understanding. What are the decisions which you take the day you feel you are really depressed and you're not yourself? Or maybe any kinds of areas in your life which are causing depression in you. How are you, behaving that day? Are you snapping off with people? Are you maybe going and getting angry with somebody whom you really love? Or mistreat or maltreat a person in your family? One day, 3 days you're very normal, the 4th day you're depressed, and on account of that you're maybe misbehaving with someone, and this is a recurrence in your behavior. Then we say the fact is that depression has nothing to do with being lazy or weak. It has got nothing to do with your self-will. The self-will certainly is when you see that you need help. You say, yes, I need help, and I need to talk it out with somebody or discuss it in a technical manner with a counselor. But you will just not wake up in the morning and say, oh, I am no longer depressed. It's not like some sort of, avatar happening or something happening in your brain chemistry, and one day you're very depressed, the other day you're not. If you are prone to depression, you will keep facing it in some or the other time, maybe with intervals. I would say you may have mood swings when you are depressed. One day you're very happy because something good is happening as per your wishes. And the other day, the moment there's something snapping off, you're opposite. Maybe your parents say that yes, we are going to buy this for you, you're very happy for some time, but in the same day itself, in the evening, something happens and you're like again back to your square norm. You don't want to eat or you don't want to sleep, you're not behaving well with people. There can be various symptoms of depression there. It results from changes in brain chemistry or brain function, and medication or psychotherapy often helps people to recover. If there is a recurrence in people for depression, if there is a recurrence in people's behavior for even anxiety, you see that this person is just not able to cope up with normal situations in life, it is always suggested for that person to take help, a very professional help. Nowadays, with so many people practicing mental health as practitioners, you have some or the other person nearby. In fact, my number is also there. In case in your area, in your vicinity, you need any help, I have a list of people who are working in this profession. My initiative is to reach out with this to common people, to laymen, to even people who are not able to afford it. In fact, Mr. Parth Satri does it for free.